here's what we're doing. External anatomy. We're going to go, and I'm going down the list on I'm going down this list right here. So we have the nares, the tongue. Hopefully you can identify the head. The hooves are the little feces, you know. Umbilical cord. Hopefully you did not cut it, although some of the groups did. Umbilical cord. You do not need to know the urogenital opening. For the males, it would be right here. But this is a female, so we'll talk about that later. The teats would be the nipples. Okay. The tail, hopefully you can figure out where the tail is. Scrotum, again, if it's a male pig. Who's got a male pig? I don't want yours. Yours sucks. Bring it here. I'm going to keep going, and then until they bring it. Genital papilla. Now, this is a female, so the genital papilla is this little teeny thing right here, right underneath the tail. It's the opening of the vagina, okay? And then we keep going down, and pinna is the ears. That's what actually the technical name is. The pinna, either one. The eye, hope you can figure out. The mouth, you can figure out. Teeth are inside the mouth. The hard palate, if you take your tongue and put it up to the front of your mouth, top of your mouth, it's hard. If you slide your tongue back towards the back, all of a sudden it gets soft. Same thing in the pig. Hard palate is the beginning of the mouth. The soft palate's at the back of the mouth. I hope you can identify the anus on both male and female pigs. It's right underneath the tail. All right. Real quickly, looking at the male pig, the urogenital opening is right below the umbilical cord. All right, so you have the umbilical cord, then urogenital opening. That's where the penis is sheathed. It's inside. It will come out when they're having sex, which is not when they're in the fetus. And then the scrotum is back here, and you're not going to like what we do with that in a few minutes. So, going over this real quickly, you've got the nares, the tongue, the hair of the chinny chin, the eyes, the pinna, the teats, the umbilical cord. This is the urogenital opening. This is a male pig. The scrotum, the anus, the tail, the hooves. Not sure if I missed anything, but there's that diagram. Okay? We good so far? Okay. Now, if we look at the internal anatomy, lay the little guy, there we go. So he's sitting upright. And we're kind of going down. Larynx, now up on the front of the board, on the TV cabinet, I've taken this list and I've highlighted the words you actually need to know. Like we're not dissecting the neck this year, so you don't need to see the larynx, the thyroid gland, the thymus gland, the esophagus, or trachea. You're not going to see any one of those. You should know what the esophagus does, though. Okay? What does the esophagus do? Because we've talked about it on 2 different other organisms. It connects the mouth down to the stomach. So it's a tube that leads from the mouth down to the stomach. All right? So now we're starting to get into the things that you do need to see. The liver is the biggest organ in there. You open it up, and the first thing you see is the liver, the big ball. It's actually got 3 lobes, 3 parts to it. Right? And I'll show you the diagram that I'm on. At the moment, I'm on this diagram here, and the liver is this one here. I will have these labeled and ready to put online today. But this is the liver. All right. Continuing down, the gallbladder. To find the gallbladder, you have to lift up the liver. All right. And you're looking for this little sac right here. Can you see that? Mm-hmm. Okay. The little sac, it's actually attached to the liver. Sometimes it's a little green, but it's usually a little soft-looking thing. All right? Gallbladder basically stores bile for the digestion of fat. It breaks down and digests fat. And on the diagram, the gallbladder is this little sac right here. All right? The stomach. The stomach is, as you're looking at the pig, it's on the right or the pig's left. Lift up the bladder, the little soft part right here. All right? And as I said yesterday, what's in the stomach? Absolutely nothing. Why? Hasn't had anything to eat yet. In the diagram, the stomach is this part right here. All right? Like I said, I'm just going down. The pancreas. The pancreas is kind of hard to find. You have to push the stomach aside, push it up, pull the intestines down, and can scrape away this tissue. And what we're looking for, I just saw, and there it is. No, that's not it. Okay, where'd you go? There it is, thank you. Is this, and look, I'm just scraping, it's little, if you see clearish tissue, you want to, you can cut that, scrape it. Don't cut the big stuff. Is this little tissue right in here, this little pink thing right there, all right? In the diagram, they have it in a little bit different place, they have it over here. All right, but it's this little pinkish gland-looking thing. And the glands, you can notice glands, they have crevices and little holes. And the pancreas, the purpose of the pancreas is to produce insulin. Insulin is used by the cells to take in sugar. If you don't have any insulin, your cells don't take in sugar, you're diabetic. So, the duodenum. The duodenum, if you follow the stomach, here's the stomach, okay? You follow it down. The very first tube that comes out of the stomach goes into the small intestine. That is actually the duodenum. It's part of the small intestine. So here you have the stomach. Oops. Too bad. I don't know whose this is, but too bad. Oh, it's Aaron's. The duodenum is the very first part of the small intestine. So it is the small intestine, but it's the very first part of the small intestine. All right? Continuing down, the bladder. The bladder is actually, this is why you didn't want to cut this little peninsula, is because the bladder is attached to it. It's just one of the places where the pig is a little different from the human. We have a bladder that's kind of separate. Their bladder is attached to their abdominal lining. And it's just this part right here. And I'll show you the bladder in a diagram later. All right, but that's the bladder. Umbilical arteries, you don't need to know. Well, actually, the umbilical arteries are the one you cut. The umbilical veins are right here. But you don't even know the umbilical. I'm not going to ask you that. Diaphragm. Diaphragm is above the liver, between the heart and the liver, and it's this shelf right here. All right? And it separates that part. And what it does is actually contracts. When it contracts, it shrinks down. It inflates the lungs. Your lungs breathe. When it relaxes, it pushes the air back out. That's how you breathe. And on the diaphragm, it's on the second page. And it's the part that looks kind of like a mushroom. This is the diaphragm right here. Okay? And then they have the spleen. Now, spleen, every student, and I kind of agree with them, it says it looks like a tongue. It goes around the stomach. So we find the stomach right here, and we find this little tongue-like thing here. It's not part of the stomach. It's attached to the stomach, but it's not part of the stomach. And it looks like a tongue, and it's the site of red blood, and it looks like this. It's the site of red blood cells production. The spleen is right there. Large intestine. This is the other spot that I think the pig really differs from the human. The large intestine is this ball of intestines. Okay, I actually heard a student yesterday ask whether this was the brain. It's not. The brain would be in the head, like ours. The large intestine is a solid bunch of attached, looks like intestine, looks like I said it's a ball. Our intestine actually goes up, over, and then back down. All right? Theirs is all grouped up like this. The small intestine is the stuff that's loose. Now, you can see where they have latex in here that has ruptured from the blood thing. If you guys want to pull this out, you can. But the small intestine, we got the large intestine, it doesn't come apart. Where the small intestine, you can pull all the individual, oh, nice. You can pull all the individual intestines apart. That's the small intestine. The rectum, if we pull aside the small intestine, and we get down to the bottom down here and pull out some more of the latex. Okay, and you can see this tube that goes from basically up here down towards the anus. That's the rectum. It stores the fecal material. It's the where the poop is stored. Okay, the large intestine going back. The large intestine. The purpose of that is to remove water. All right, that's where your